Good evening, ladies and gentlemen. Welcome to Reference Point. I'm your host, Dave Cokerhook, and we're back tonight for the second of two-segment conversation on Emergency USA and the work that Emergency International is doing around the world to help the victims of armed conflict. And with me here again is Eric Talbert, who is the Executive Director of Emergency USA. Eric, welcome back.
Thanks, Dave. Thanks for having me back.
Very cool. So I want to start off this conversation by just last episode, we talked a lot about the work that had been being done in places like Afghanistan, in these war zones, and in Sierra Leone with the conflicts there. It seems to me that your people are actually literally in harm's way. I mean, there's bombs going off all around them and stuff like that. I mean, how do you maintain a level of neutrality? Do people that are there on either side of the conflict recognize why you're there, and do they respect that?
Yes, they recognize. They know where we are. They have our coordinates, and they know what we're doing, and they do respect it. They understand that this is an important need, and this is something that we can fulfill, and we do it, as you mentioned, in this neutral way, and provide this high level of care. So it's very much respected, and we're left alone to do what we do best, which is heal people.
That's fantastic. I know that from reading the book, we talked about this book in the last segment. It's called Green Parrots, and it's by Gino Strada, who was the founder of Emergency. Yep. And there are certainly some incidents where there's stuff going on right around them, and they're performing surgeries with bombs going off right around the campus and stuff like that. I mean, it's just, your guys are incredible. I don't know how people do this. It's just like, it's mind-boggling to think that you would be able to actually focus and do that kind of work while all this other stuff is going on around you.
Yeah, there's some really brave people, and it really being able face-to-face with life and death, literally, as you mentioned, with the bombs being dropped outside, being in the surgical room with these folks. And ultimately, I think a lot of people are able to do it because they see so much hope and so much potential in these other individuals, and knowing that this surgery can save their life, and they can go on and continue to make their decisions for their best life and further their education. So ultimately, it's a huge challenge, but the folks who are there live up to that challenge and are inspired by the people they get to meet and get to serve.
It's amazing. You mentioned in the last episode that the medical staff that are deployed are actually paid for that 6-month or 1 year, however long they choose to stay. And I assume that when you're building a facility like the hospital you guys built in Afghanistan, that the contractors that are building that are getting paid and stuff like that. Well, all this takes money. Where do the funds come from?
That's right. Yeah, everybody's paid. Part of that's maintaining that high quality care, but also out of respect for people's individual skills and their time. And so our funds primarily come from individuals. I know it's some kind of hard to believe when you think about what's going on in these areas, but part of my job and part of what I really enjoy here in the U.S., I get to work with over 1,500 individuals. Just people like you and I, whether they gave $40 or they give a few $1,000s to help us continue to provide these services, and we're really grateful for all those individuals, and it helps us be able to provide the life-saving surgeries that we need every day, all day long, and it's that type of funding and people get involved.
So how do you guys get the word out?
We get the word out through the book, Gino's book, also through our website, which is www.emergenceusa.org, as well as doing interviews like this. Mm-hmm. And there's also some other media that's been mentioned here in the U.S., which is also part of my role, is working with other, getting news coverage of what these staff members are seeing and what they're doing in these areas of conflict.
Got it. So if somebody that's watching our show today is interested in finding out more, we're trying to figure out how they may be able to help. Maybe they're medical personnel, maybe they're not. Yeah. How do they reach? How would they communicate to find out more about how they could help?
The best thing to do would just be to email us if you have a question or a thought, and people can reach us at info@emergenceusa.org. And we get a lot of folks just kind of randomly if interested in medical supplies or providing medical services, or they might know somebody who knows somebody, or they themselves have a contact. And part of what's great about being here in the Bay Area is there's so many people willing to help and willing to support this work. And throughout the U.S., it's been, for me, that's my inspiration every day, is working with these individuals who, I've never known before, and then they hear about the story of Emergency and they reach out and we're able to work together.
That's fantastic. Well, I want to talk some more about what you're doing, what the organization is doing. And specifically, I want to talk about something that And the first time we had a chance to talk and meet several weeks ago, you were telling me about that was a phenomenal story that is absolutely mind-boggling, and that has to do with the work that you guys are doing in the Sudan. Mm-hmm. And you had mentioned a little bit earlier when we were off camera that the emergency has been in Sudan for about 10 years now. Is that about right?
About 10 years, yeah. Emergency started in Al-Fashir, which is the capital of North Darfur. And at the time, the conflict that was going on there, we helped refurbish and supply a surgical center in that area. Through that, contacts and relationships were made with the ministries of health, and there was a need for a pediatric clinic in one of the IDP camps. This is an internally displaced persons camp. So these are people from the south, from Darfur, from all the different areas who unfortunately end up living, literally, Dave, I've been there myself, it's incredibly heartbreaking, living in mud huts as far as the eye can see. Like, you just can't see the end of these things.
It's tens of thousands, if not millions of people that are displaced.
That's right. This one camp has about 300,000 people living in it.
Wow. For
over a period between, depending their age, but it's been there for about 20 years.
Wow. I want to go back to the first thing you said about refurbishing or reinitiating the clinic. So when they did that, was there, the conflict was still going on and emergency personnel were doing what they do, which is war medicine, trying to help the civilian population who had been harmed by some of these conflicts? Is that what was going on?
That's right. And that's part of why the opportunity in the IDP camp called Mayo came about, was through those relationships and say, here's a group of people who are treating the civilians, but also have this expertise and are able to come in and do what they do incredibly efficiently, effectively, and have a big impact despite this overwhelming need.
Okay. But it evolved from that.
Yes, one way to put it. Through these relationships and through this clinic, what was discovered, again, by Gino and a lot of his close staff that have been with the organization for a while, was something that we hadn't planned on. And what we kept seeing were these kids with heart disease.
Heart disease.
Heart disease. You show up in pediatric clinic, we're treating malaria, TB, all these very common.
You would expect in that type of thing, dysentery, malaria, all those kind of things.
Definitely, but the rate of the children showing up with heart disease set off a red bell. To mention before, Gino trained as a cardiac surgeon.
Right.
Decided to become a war surgeon, but being the kind of the perfect fit as an organization. And recognizing what was going on, and this was a very large unmet need, not only for Sudan, but the entire area of Sub-Saharan Africa.
Well, when you say children with heart disease, what are you talking about? Somebody that's like, here, anybody who's under 18 or 21 or something like that, is concerned. Yeah. So what are we talking about in terms of the ages of the young people who were presenting heart disease symptoms?
Well, some as young as 6, and one of the pictures here.
6?
Yeah, very young girl. This picture here, her name's Angie. She's only 6 years old.
This is the photo that we're showing on screen right now.
This is Angie. She's from Rwanda, and she was transferred to our hospital in Sudan, received this high standard free of charge open heart surgery, very complex, very advanced procedure, and ended up receiving mechanical valve, and now she's back home in Rwanda with her friends and her family and going back to school.
So this heart disease situation in the young people is not just in the Sudan by virtue of the displaced persons who are having the struggles, and this is a much more this is a broader problem. I guess is that a way to say that?
That's right. This problem crosses borders, and part of our solution in our attempt is to address this cross borders.
So tell us about how you came up to recognize the problem.
Well, the medical team was able to diagnose this and say what's going on is strep throat. Common enough.
That's right. Kids have it here all the time.
I had it a few times, right? Very common disease for children. And in the West, this used to be the #1 killer of children 100 years ago. But with the advent of penicillin, with adequate distribution and information, education, as well as supplies, it's virtually gone.
Right.
I mean, people still get strep throat, but it doesn't go untreated. And this is what's happening in Sub-Saharan Africa.
You catch it, you go to the doctor, he prescribes penicillin or something else like that, and then a few days later you're feeling better.
That's right. But if it's not being able to be diagnosed, not being able to be treated, it develops and it comes back. Strep throat will come back, and then that causes rheumatic heart disease, and that ends up attacking the heart valves to the point where the heart will go into arrest.
So untreated, this typical, the standard kids disease will present itself as, what did you say, rheumatic heart disease?
Yep.
Which attacks the valves of the hearts. And so these kids, but you don't see, this is not something you physically see. No. It's not like, the skin's turning green or yellow or something. It's just all happening inside. And so how did they figure out that this was actually what the problem was?
Yeah, this is a silent killer for a very long time. And so it was taking a look at the data and the resources that were available and partnering and with other organizations and seeing what were they seeing. Were they seeing this, and who else was doing what about this, so we could find a way, if appropriate with the local partners and relationships and long-term commitment, do what we do best, which is surgery. And so this is what developed into the process. So we were treating these kids with penicillin at our clinics,
right?
When we caught them early enough, but the kids who did not needed some type of intervention. And this is what we found out was not being done. This was the next frontier. This was the area and the opportunity for innovation.
Wow.
Was to be able to provide high standard, free of charge, open heart surgery for children in Sudan.
Wow. And that's what you're doing right now.
The Salam Center is the name of the hospital.
And I think we have an image of that right now.
There's an image here, and it's a very, again, high quality. This is a beautiful structure. This is a place to come to heal. And the architecture on this building has also won several awards, as well as a design award. So we really put all of our heart and soul into this, and as a new project, all that we've learned and what we wanted to, and hope even from a human rights perspective, into this one hospital. And it's been there now for 7 years. It's provided over 5,000 open heart surgeries.
Wow. Like
to Angie. And then the kids who end up with the mechanical valves, they then need pharmaceutical treatment. It's basically anticoagulant, so blood thinner. For their mechanical valve for the rest of their lives. And so sometimes they're able to receive that from their home country. Other times we continue to provide that as well.
Got it. So if you're performing this open heart surgery on a 7-year-old to repair the valve, as that child grows, does the valve need to be adjusted, or is it works whether they're, because they're going to grow. Things are going to get bigger.
That's right. The valve, the technology has advanced so much that the valve is kind of a one-time insertion, assuming everything goes well. There's no manufacturer defect, which we hardly ever see. The valve is good for life.
Wow.
So these kids are able to go back, go to school, and just maintain that valve.
So before this was determined, what was the life expectancy of the average?
Oh man, with the kids it depends on how advanced and how quickly it came. It really was, for kids under 14, once they got strep throat, and it happened a few times, it wasn't long, 6 months maybe. And for them, what happens as the valve deteriorates is then you just get really tired, your bones start to ache, you get kind of sluggish. It's definitely painful, but as you mentioned, there's no real visual, it's not an amputation or this type of a visual cue. So that's also part of what we're working on and providing capacity for, not only this advanced open heart surgery, but also diagnosis. So we have a team of folks who travel throughout Sudan as well as throughout the entire continent to provide screening with a portable echocardiogram.
Oh, wow.
Because that's the quickest, best way. You can see the valve right there. These guys are highly trained professionals, and they can do a printout, send an email.
So this isn't something that just started to occur 3 years ago.
No, this is unfortunately has been going on in this region for a really long time. It's just a matter of being the organization with at the right time, with the right skilled staff in place to be able to have enough courage to take it on.
What we're saying here, it seems to me, is that untold thousands, if not hundreds of thousands, of kids died from something that was preventable had they had access to even rudimentary medical care. Oh, you got strep throat, you take penicillin. But now it's progressed to this point. So there's you have any sense of how many people might have been impacted by this that are currently in a situation where they may need a surgical intervention like this?
Yeah, the numbers show is it's roughly about 300,000 people a year die from this.
300,000 people a year die
in this area from this issue.
Whew.
Yeah, it's a major problem.
Yeah. So you have the facility, and there's a picture of the operating theater right now that we have that's in the Salam Center. So you've got the one facility there that's providing this surgical intervention. Is that correct? And what's the plan going on from here? 300,000 people a year are perishing. There's an awful lot of folks that are going to need some help.
Yes.
So what's the plan moving forward to expand the capacity for delivery?
Yeah, part of that is coming at it from both angles and being able to continue to expand the screening and the prevention that we're doing in our existing clinics and being able to build more clinics to be able to do that. Because through those clinics, then we're able to transport these kids to the hospital, which is in these areas makes the most sense for efficiency from time and money and treatment. And then forming partnerships and continue to work with other countries like Rwanda, and even at our own hospital in Sierra Leone. Our team goes there and does cardiac screenings, and we've treated kids from Sierra Leone. The original vision for this hospital was to be able to, again, focus on that Sub-Saharan region. So we're talking about Sudan and the 10 bordering countries. But since these past 7 years, the Salam Center has actually treated patients from over 24 different countries.
Wow.
So it's much larger than we thought, and continue to expand that way. So being able to provide technical support and assistance, as well as the screening and the follow-ups from the surgical side. And we also hope that this hospital inspires others to understand how dire the surgical need is. I mean, we don't, as far as I know, this is the only hospital of its kind on the entire continent.
Wow. And
someday we hope to be able to say it was the first.
The first, there you go. So let's explore this just a little bit from another perspective, because we had talked in the earlier show about the fact that there is collaboration that goes on between emergency and other health organizations. So when this was determined and identified as a problem, and the how the disease migrated to the heart problem, are the other medical personnel, the other medical organizations now providing lots more early stage care to the population? That's
right, vaccination. So in addition, there's this kind of simple understanding of, enough vaccination. That's obviously part of it, but it's also access. A lot of these kids that we see, like Angie, are from the rural areas. They're not near the capital where they have a major hospital.
Right.
So it's being able to work with, and these other organizations that have been working on this issue for a long time. We're not the only ones doing that, but we're the only ones focused right now on the surgical side in this type of capacity.
Got it. Okay.
So, and it's been a nice collaboration to be able to send patients back and forth and work with other families and to provide more services.
That's fantastic. Now, have you been to the clinic at Sierra Leone? In the Sudan?
I have. I've been to both. Yeah, the hospital in Sudan, the Salam Center for Cardiac Surgery. Obviously, I'm a bit biased, but it's still one of the most innovative and impressive hospitals I've ever been in my life. And to this day, is still like the day it opened. Meaning, it's in the middle of the desert. It's incredibly hot all the time. Sudan has these really massive, incredible sandstorms.
Oh yeah, right.
And yet, Gino and his team and our other staff are able to do open heart surgery in a completely sterile environment 3 times a day.
Wow.
And the hospital continues to run as off of the solar energy powers that have been built, the engineering and all this architecture that we talked about to make it the state-of-the-art center that it is.
Wow. So at this point, you had mentioned previously too, Eric, that eventually emergency looks to turn over the facilities that it builds to the local people so that they can operate it. Now, how are things progressing in that regard to the Salam Center?
The challenges with the Salam Center right now is really thinking about things in a new cycle, really understanding that these types of projects are 10 to 20 year commitments. Sometimes we think about things in a 3 to 5 year, maybe 10 year, when you talk about international development. And that's for us is just the beginning. And part of the challenge here is training enough local staff in specialties. So we have the nurses, a lot of local Sudanese nurses working within the hospital, but they may not have a lot of pediatric experience. They may not have a lot of cardiac. So it's the specialties that we're really focused on. And same with the physicians and the surgeons. And being able to provide them with this high quality education in a state-of-art facility and be able to inspire them to want to stay.
Is there a plan to build or either to expand the existing facility or to put another one in the Sub-Saharan area?
Yeah, there's so our first, as I mentioned earlier, we're really looking at the Sudan and the 9 bordering countries, and working with the ministers of health through our humanitarian office. And right now, the first country to come on board is a pediatric clinic in Bangui, which is the capital of the Central African Republic. That opened in 2009. Unfortunately, for the past 18 months, that country has been at war. So our focus there has gone from pediatrics and cardiac screening back to war surgery. So we find ourselves kind of where we started there for now. And we've also sent in a war surgery team to that main hospital for extra support. But looking forward, our vision is to be able to build a new surgical center focused on pediatrics in Uganda. And that's kind of our next big initiative, looking forward to the next 3 to 5 years for us as an organization.
So there's no lack of opportunity to help, is what you're saying.
That's right. Yeah, no, there is not. There's plenty of room and need for help, and plenty of opportunities to fit people how they want to help based on their experience.
When you look at the possibility of a medical person participating, what do you look for there? I mean, what are some of the primary criteria that you look for in terms of determining whether someone would fit the needs that you guys have?
The basics are people will email that info address, and first thing we ask for is they take a look at their CV. And what we're looking their CV, their resume, if they're a doctor.
Okay.
And what we're looking for is at least 3 years post-graduation experience in a hospital or in a clinic, and at least 6 months availability to go live and work in Sudan or Afghanistan. And then we also look for teaching experience. In addition to being an attending physician, are they spending time outside of that to provide more education? Because that's a big part of what our international staff is responsible for, back to the sustainability model, is provide that training to local staff. But the English is the main language requirement, so that's often an easy checkbox for us, at least here in the US. But it really comes down to those two main things, that 6 months availability and having at least 3 years post-residency experience.
Got it. Now, Emergency began in Italy. We now have a US affiliated organization. Are there other countries that have is there an emergency France or an emergency Argentina or something like that?
There is, yeah. So here in the US, in addition to our local volunteer groups, obviously here in San Francisco and LA, and we also have groups in Atlanta and Chicago, New York, and doing a lot of the human rights work and outreach. But we also have other colleagues working in Emergency UK based in London, Switzerland, and Brussels, as well as Hong Kong. It's kind of the most recent one.
Oh, go figure.
Yeah, our folks in China helping out and doing what they can to support this type of work.
Do you guys still have, you mentioned Cambodia once before. Is there still activity in Southeast Asia that Emergency is participating in?
No, it's Afghanistan would be the closest to Asia that we currently have programs in.
Understood. Well, very cool. So, all right, so somebody who's interested in being, who has the medical experience and can maybe teach, et cetera, they should communicate out to you, send your resume, then you have a conversation, and hopefully you can go from there and you get people to sign up. I mean, what you guys are doing is amazing, especially when you start to think about the cardiac surgery that you're now performing in the Sudan. For the people that live there, if they are understanding, if the population is beginning to understand what it is that you guys are offering, they've got to be extremely excited about it.
They are, and this is, there is a medical school in Khartoum. There is other organizations working on this, as well as local commitment in that area. So that is for us where we see the next area of focus is being able to take on non-communicable diseases in this high capacity way in these areas that are entirely, nations and continents that are incredibly underserved, but just like get things going, right? Not just kind of look around and say, well, who's going to start? But be the ones that kind of jump up and say, we're going to take this on and we're going to do it.
I would think that if it were possible to not have to do war surgery anymore and just focus on some of these other underserved medical needs, that would make you guys very happy.
It would be a bittersweet. We obviously we want to help support peace in the areas that are suffering from these conflicts, because we see the civilians and the children day in and day out.
Right.
And the sooner those folks can go home and that community can take over that hospital, and we can take on these more initiatives around the non-communicable diseases, rheumatic heart disease being one, cancer being another huge issue that's just entirely, virtually unaddressed in these areas. So that would be our goal and our hope for the future. And again, back to our core, which is surgery, because we believe if you build a surgical center, you can provide all these other services underneath it.
And hopefully we'll get smart as humanoids and stop blowing each other up, so that you can focus on some of these other things that just happen by virtue of life that that organizations like yours can serve. Eric, thank you so much for being here and being willing to share with us about all the work that you folks are doing at Emergency. I want to remind folks you can go up to their website, www.emergencyusa.org. Take a look at what they have on the website. Get a copy of this book, Green Parrots. It's incredible. It really gives you a sense of what it is that Dr. Strada and his team are doing worldwide, and it's well worth your time to read. It's inspiring, a bit scary, but inspiring at the same time. So Eric, again, thank you so much for being here. Is there anything else? We got about 25 seconds left in the show. Anything you want to close off and saying to people?
Just visit the website, contact me if you have any information. More than happy to chat with people.
Fantastic. Thank you so much for being here. Really appreciate it. And ladies and gentlemen, we'll see you next time on Reference Point.